Good morning everyone. I'm Dr. Abhishek Bhattacharya and I'm a pediatric dentist from Dental Cure Advanced Multispecialty Dental Clinic from Mumbai. And today I'll be discussing on the most common complaint that I receive from most of the patients is that my child grinds his teeth during the night time or during the daytime. Now usually why this happens is because the first question which I ask the patient is your child breathing from his mouth? Reason being is when a child breathes from the mouth, he doesn't acquires 100% oxygen to his lungs. Now because of which what happens, the child is not able to sleep in the night time properly because he is trying to constantly breathe from his mouth. Now because of which what happens, the physiological stresses are increased. Now because of that, the child tends to starts grinding his teeth. Now usually a child has a lot of other stresses like school stress, exam stress, coming in first in the school or exam or in sports. Now because of which already a lot of stress is there in today's child. And when a child starts to breathe from the mouth rather than from the nose, he doesn't get proper sleep in the night. And because of which from internally the physiological stresses also increases, which might lead to the child in grinding the teeth. Now during this case, what we need to do is we need to first evaluate the child whether he is a mouth breather or not, or whether he breathes from the mouth or not. Once evaluated, we will try to first sort out the mouth breathing habit by giving some appliance therapy or by doing some exercises which will help him to breathe from the nose rather than from the mouth. In certain cases, extreme cases, we might have to take a suggestion of an ENT specialist or an ear, nose, throat specialist to rule out any obstruction in the nose or in the throat. If there are any obstruction in the nose or throat, we need to first cure that out before we go ahead with the dental interventions. Now in these kind of cases, hence we need to look into it whether the child is a mouth breather or not first, and then we can start treating the grinding action, or we call it as Bruxism habit, by giving some appliances which he needs to wear for say 24 hours a day or 6 hours a day, or depending on the severity of the problem. Hence, I would like to say, if you notice your child having teeth grinding or bruxism habit, do visit a pediatric dentist immediately and get that sorted. So if you have any doubts regarding your child's grinding action, or if you have any doubts regarding pediatric dentistry or his treatment plan, please do get back to me through the link below or comment me in the comment sections. Thank you.